The topic of my speech is breast cancer and breast cancer awareness and how we can educate ourselves as women to recognize the signs and symptoms of breast cancer. My general purpose will be to inform women about different risk factors of breast cancer and maybe how to prevent it and educate women on diagnosis and treatment of breast cancer. Although breast cancer cannot be entirely prevented, there are some steps that we can recognize and uh, seek treatment for in the early stages of breast cancer. There is a higher survival rate in women when women consider factors pertaining to breast cancer. So we should try to empower and educate and encourage other women about breast cancer awareness. According to the National Cancer Center, in the fiscal year of 2017, the National Cancer Center Institute devoted $500,000 to breast cancer research. Besides lung cancer, breast cancer is one of the leading causes of death in women. Knowing what breast cancer is and being educated on preventative measures can increase the survival rate of breast cancer. Being educated about breast cancer is the most important tool. Being educated includes being knowledgeable about risk factors of breast cancer, scheduling annual mammograms, and diagnosis and treatment. Breast cancer is the form of cells that occur, abnormal cells that occur in the breast. Breast cancer is the second most common cancer in women. Although a definite cure has not been found, breast cancer can be diagnosed and treated by a medical doctor. There are some things women can do to educate themselves about breast cancer. Being knowledgeable about different risk factors and seeking diagnosis and treatment early are all factors of surviving breast cancer. We'll talk about some different type of risk factors. Our first risk factor will be family history. Women with close relatives like grandmothers, mothers, and sisters are a higher rate of having breast cancer. Women with a significant family history of breast cancer could require genetic testing, which can lead to early diagnosis of breast cancer. Genetic testing for breast cancer is a blood test that evaluates the changes or the mutations that increase the risk of breast cancer. Risk factor number 2 is age. Although breast cancer can occur in all women, different races, and backgrounds, age is considered a risk factor for breast cancer. According to the Texas breast specialist, the most invasive breast cancers occur in women over age 55. Risk factor number 3, lifestyle. Leading a poor lifestyle is a risk factor for breast cancer. Women should include diet and exercise in their daily routines. Being overweight and inactive can produce a higher risk of developing breast cancer. Being overweight and or obese can cause dense breasts. Women with dense breasts have a higher rate of developing breast cancer. Now that we talked about some risk factors, let's talk about early detection of breast cancer. Two main types of things that we can do for early detection of breast cancer is self breast examination and annual mammograms. Self breast examinations can help detect early breast cancer. Committing to do self breast exams can help a woman for any lumps or anything irregular in her breast. Doing self breast exams at the same time every month can help you know how your breast should look and feel. There are two ways that you can do self breast exams. One is standing up and the other is lying down. Please visit www.healthywomen.org for more information on how to do self breast examinations. Scheduling your annual mammogram. Mammograms is the leading factor in early detection for breast cancer. Mammograms are x-rays that examine the breast and the breast tissue. Mammograms can be done as young as age 40 because of family history. Annual mammograms are considered a preventive measure for breast cancer, and they're usually free of charge by insurance company on an annual basis. Consult your physician or when to start receiving your annual mammograms. We've discussed risk factors, early detection measures. Now let's discuss treatment and diagnosis. A formal diagnosis of breast cancer should always come from a licensed physician. A woman should never try to diagnose herself of having breast cancer. um, immediately after you suspect something or you notice changes in your breast, you should contact your physician immediately. If you are diagnosed with breast cancer, discuss with your physician. In most cases, you might discuss with your oncologist, which your oncologist is a person who treats cancer. Most breast cancer treatments include chemotherapy, radiation, and in some cases a mastectomy, which is removal of the breast. Hold open discussions with your family or friends for support during diagnosis and treatment. Being diagnosed with breast cancer can be overwhelming for any woman and any family. If you know of someone who is a survivor of breast cancer, take a chance to encourage, educate, and empower that woman or somebody who you know who's been recently diagnosed. Thank you.